Module 6. Pain as the fifth vital sign. Pain is personal. It cannot be seen, touched, or measured directly, yet it affects everything about a patient's health, comfort, and healing. That's why pain is now recognized as the fifth vital sign. It deserves the same level of attention as temperature, pulse, respiration, and blood pressure. Meaning and importance of pain assessment. Pain is the body's natural warning system. It tells us that something is wrong, physically or sometimes emotionally. Assessing pain helps healthcare providers understand how the patient feels and guides them in providing the right treatment or comfort measures. Ignoring pain means ignoring a key part of the patient's well-being. That's why every healthcare encounter should include a pain assessment. Types of pain and assessment tools. Pain can be classified as acute pain, short-term, sudden in onset, usually related to injury or illness. Chronic pain, persistent pain lasting more than 3 months. Referred pain, felt in a different area from the source. Several tools are used to assess pain. The most common include Numeric Rating Scale, NRS. The patient rates pain from 0, no pain, to 10, worst possible pain. Visual Analog Scale, VAS. A line or slider showing increasing pain intensity. Faces Pain Scale, especially useful for children. They select a face that matches how they feel. How to assess pain. When assessing pain, it's not just about the number, it's about the story behind it. You can use the mnemonic Socrates to guide assessment. S. Site. Where is the pain? O. Onset. When did it start? C. Character. What does it feel like? Sharp, dull, throbbing. R. Radiation. Does it spread anywhere? A. Associated symptoms. Nausea, sweating, etc. T. Time. How long has it lasted? E. Exacerbating, relieving factors. What makes it better or worse? S. Severity. On a scale of 0 to 10, how bad is it? Always ask open-ended questions and observe the patient's facial expressions, posture, or tone of voice, because pain is not always verbalized. Documentation and clinical relevance. Once assessed, pain must be recorded accurately in the patient's chart. Document the intensity, location, and characteristics, and note any interventions given. After treatment, reassess pain to determine whether the intervention was effective. This continuous process ensures compassionate, patient-centered care. Pain management is not just about medication. It's about empathy, communication, and trust. To summarize, pain is the fifth vital sign because it reflects a patient's comfort and well-being. Use reliable tools like NRS, VAS, or FACES scale. Assess, document, and reassess pain regularly. Always remember, managing pain means caring for the whole person, not just the disease. You've now completed all modules on vital signs. From temperature to pain, you've learned how to observe, measure, and interpret the body's key indicators of health. Congratulations, you've completed Module 6, Pain as the Fifth Vital Sign, and the Basic Vital Signs Mastery Series.